Hello, everyone, and welcome to the CAP webinar. Our topic today is parent management training in primary care. And before we start, I'd like to share a couple of quick announcements. Let's go to the next slide, please. So we have just launched a new activity for continuing medical education. For those who can't make the noon hour for the live presentation of the webinars, we are now going to be posting the recordings for CME credit. And you can view the webinar, answer a couple questions, and if you pass the post quiz, then you can get both the AMA CME credit along with American Board of Pediatrics MOC Part 2 credit for that hour-long activity that you completed. There is a charge of $50 for the year, but then you can access this year's webinars and the prior year's webinars as well, including our core series, which is what we consider like the main core pediatric mental health skills that we recommend for pediatric primary care providers. So you can go to this link and we'll post this in our chat in just a little bit if you'd like to find out more and to sign up. Next slide, please. This is our full disclosure slide. Nobody has any financial conflicts of interest to disclose. We do get funding both from the Federal Health Resources and Services Administration as well as the California Department of Healthcare Services. And next slide, please. And so with that, I would like to introduce our speaker for today. We are very lucky to be hearing from Dr. Christine Zalecki, who is a clinical professor in the Department of Psychiatry and Behavioral Sciences here at UCSF. She directs the Hyperactivity, Attention, and Learning Problems Clinic here at UCSF. She's also an attending psychologist in the Schwab Dyslexia and Cognitive Diversity Center. Dr. Zalecki is a licensed clinical psychologist who specializes in the diagnostic assessment of ADHD and learning disorders and psychosocial treatment of children and adolescents with ADHD and behavior disorders. Dr. Zalecki received her BA in psychology from UC Berkeley and her PhD in clinical science from UC Berkeley. She subsequently completed her pre-doctoral internship and postdoctoral fellowship in the UCSF Department of Psychiatry. She has been the director of 2 NIMH-funded studies of ADHD, the follow-up study of girls with ADHD at UC Berkeley, and the Child Life and Attention Skills Program at UC Berkeley and UCSF. She was also a clinician in the NIMH-funded MTA study at the UC Berkeley site. And with that, I'm going to hand the virtual mic over to Dr. Zalecki.
All right. Thank you very much, Dr. Zhang. Hi, everyone, and thank you for inviting me to talk today. I will be talking about parent management training, or PMT, particularly with children, families who have ADHD and disruptive behavior disorders. And listed here really are the learning objectives, but my overall objective is hopefully to give you all a better understanding of what we're doing when we're working with families in PMT, so that when you make a referral for this type of intervention, you have a sense of what we're actually doing when we're working with families, and also hope to provide some, basic behavioral tools that we work with families on, that you could also model some of these when you're working with families, or at least if they come in and are presenting to you some challenges they're having with behavior, especially at home, you might be better able to help them troubleshoot through some of those using some of these behavioral tools. So this will be posted and available. So some of the information you'll be able to access and then hopefully, share with families if you'd like. So the tools that I'll be talking about are, this is an parent management training is an evidence-based treatment for ADHD. These tools and strategies that I'll be talking about are general tools that can, not just, of course, work for kids with ADHD, but other children as well, but particularly important for kids with ADHD. So just to quickly cover our primary ADHD symptoms, of course, a cluster of inattention and distractibility symptoms, hyperactivity, impulsivity symptoms, in early childhood, impairing across settings, and exceeding what's developmentally typical. Now, I refer to these as primary symptoms because in a moment I'll be describing kind of secondary symptoms or kind of related impairments. And really, for these primary symptoms, medication does, for most kids, especially when it's in the moderate to severe range, really carry the day as far as reducing symptoms. So for a child who's very inattentive, very distracted, very impulsive, hyperactive, behavioral treatments might have some effect, but really it's medication that's most helpful for these primary symptoms. However, it's for these kind of ADHD related impairments or secondary problems that kids with ADHD have, where the behavioral treatments really can be helpful. So for example, homework, for a lot of families is really challenging. Both parents and kids are exhausted at the end of the day. For kids on medication, the medication is worn off. So homework is very challenging. These kids have very low frustration tolerance. Emotion dysregulation is not, a primary symptom of ADHD, but a lot of kids with ADHD are quite dysregulated. Routines are challenging, getting ready in the morning in particular, and I'll talk a lot about morning routines for that reason. Really, really hard, a lot of procrastination, disorganization, spaciness, and conflict is really common, both with siblings, with parents, with peers, lots of negotiation. I'll talk a lot about that. And then for kids with combined type ADHD, just having a hard time sitting through anything. And I'll say this mealtime issue that I've listed here can also be really problematic, even for kids who are very inattentive but not hyperactive. Long time, just getting through meals can be really a struggle. And then just basic motivation. We know that for kids with ADHD, there's just something very different about the motivation system. What tends to motivate kids without ADHD, just for example, doing homework, the promise of getting a check mark or kind of a pat on the back or good job, it is just not sufficient. There are other things that are far more motivating. And so that's a lot of what we're doing in PMT, is really trying to boost that motivation system as much as possible so that they're motivated to actually do things that are not preferred activities over these preferred activities. Now, I'm listing here just, I'll be talking about parent management training. It's also called behavioral parent training, but I wanted to list these other treatments that are out there. Know that, of course, medication, that summer treatment programs are fantastic, but typically the classic STPs tend to be on the East Coast. There is a program in the East Bay, I think that is a summer treatment program, but those can be tough to find. Of course, there are classroom. There are some organizational skills training that are schools-based. Family therapy can be very helpful for older, adolescents and teens, especially when there's oppositionality. But there are a handful of PMT-like programs. So for example, if you hear about Triple P or the Incredible Years, those are essentially very similar to what I'll be describing today. PCIT, Parent-Child Interaction Therapy, that's really a fantastic intervention for much younger kids, age 3 to 7, where it's a somewhat similar model to what I'll be describing, but there's actual moment-to-moment coaching for how the parent can work with the child. So just wanted to let everyone know these are different interventions that are out there, but they're behavioral, but I'll be talking about PMT specifically. And what's missing from this list, you'll see, is individual child therapy. Sometimes we do get referrals for kids to be in individual therapy for ADHD, and it really isn't an evidence-based treatment. It's really working with parents, working with teachers to change the structure, change the environment to really help the kids. But working with them in individual therapy for ADHD per se would not be indicated. For comorbidities such as anxiety, depression, trauma, yes, then individual therapy, but not for ADHD per se, for the symptoms of ADHD, unless there's a very heavy parenting component as well. Now, sometimes, there are some who wonder, well, our medications work very well for ADHD, especially stimulant medications. So why would we need kind of parent-focused behavioral treatments? Many parents are, it's a lot of work. They're not super motivated for it sometimes, but we know that not all kids are med responders, not well tolerated, or there might be some medical reasons why they're not able to take stimulants. And some parents, of course, really do not want to medicate. Also, medications, they don't teach new skills. Whereas that's ideally what we're doing in PMT, is also really coaching parents on how to coach them on some new skills. And parents will often say, yes, they're on medication now, and the teachers are thrilled, But guess what? Morning routine is still a nightmare. And homework is really hard and evening routine. So that's also where parents having some tools can be very, very helpful. And as I mentioned before, medications can be really helpful to reduce those primary symptoms of ADHD. But sometimes, even when kids are on medication, there are these secondary features like conflict with parents, lots of negotiating still, poor academic habits, and similar. So that is why this can be very helpful, that even when kids are on medication, this can be helpful. Medication can really pave the way for these behavioral treatments to really be effective. So what we're doing in PMT as an overview is really, providing some psychoeducation about ADHD, some coaching about how to change that behavior by adjusting, as I'll talk about, antecedents and consequences. And we're really essentially coaching, as I said, the parent on how to coach the child to learn some new skills. I often say, kids with ADHD are dysregulated across different systems, the attention system, the behavior system, for some, the emotion system. The more we can really, when someone's very internally dysregulated, especially in multiple ways, the more we can regulate the environment, the better. So this is, again, demonstrated effectiveness for both ADHD, ODD, and conduct disorder. And what we're, one of the primary things we're doing in PMT is really targeting some negative parent-child interaction patterns. So I want to quickly go through this. And I will use morning routine as an example, mostly because this, again, is really the crux for a lot of families to get through the morning routine. And it has a definite beginning and end. And it's typically the same way each day, which is different from homework routines, afternoon routines. But what we typically hear from families is that in the morning, they'll tell their child, okay, time to get ready for school. And maybe their voice is calm, they're optimistic, they're not yelling. It's just, hey, time to get ready. The child does not do anything, does not get ready. So the parent repeats. Now, I mean, the pink space there, the parent repeats it by maybe getting a little more loudly, a little louder. Hey, time to get ready. Child does not get ready. Maybe they're playing, they're distracted, they have one shoe on, but can't find the other, whatever reason, they're not getting ready. So now we have the parent, we've got to get going. They're repeating, they're perhaps yelling, child's still not getting ready. So then we have parent yelling, maybe threatening, if you don't get ready, no play date, no screen time, whatever it is. They're visibly frustrated, perhaps being critical. And this can go on and on. Parents will sometimes say this cycle can happen almost 5, 6 more times. So how does this typically end? I'll ask families. Well, maybe at the last moment, the child rushes to get ready and they do get ready. In a lot of families, the parent will help them. They'll get them dressed. I have worked with parents of 7th and 8th graders who are still dressing their children because they got to get out of the house. But eventually they get out of the house, but everyone is frustrated. It's not a great way to start the day. But in this scenario, what we see is that with this pattern, both parents and kids are inadvertently teaching each other things that are not very helpful. It works in the moment, they get out the door, but the parent has inadvertently taught their child that they don't really need to listen the first time. And when they give an instruction in a nice, calm voice, they don't really have to listen. They don't have to bother responding because the parent will repeat it, right? They also learned that, the parent eventually might even do it for them, right? So they don't, the parents inadvertently taught their child that, saying something in a nice, calm voice, they don't really need to do anything. And what has the child inadvertently kind of taught the parent? They've taught them that yelling and threatening works in the moment. A lot of parents will say that. They don't do anything until I yell and threaten. So nagging, repeatedly prompting, it kind of works. And in the end, they might even just have to do it for them. So again, it gets them out of the house in the morning, but it's not sustainable over time. And everyone does not leave the house feeling so good. So again, parents learn that they have to kind of rely on nagging and yelling and threatening, doing things for the child, and negotiating. Lots of negotiating goes on in these families. They're often not attending to good behavior. They're just focused on the bad behavior. And kids are learning that, they can ignore instructions, that, negotiating actually works. Sometimes I can get those extra minutes of screen time, or I can be on my tablet. Also, the parents don't really mean it until they yell. And negative attention is still attention. So these are very common patterns. This develops in, some families, even in the absence of ADHD, but especially for families when there's a child with ADHD. So this is really a lot of what we're targeting when we're doing PMT. And the model that we use is the ABC model. Um, Really, this is, antecedents, behaviors, consequence. So behavior is, the child's behavior. It's observable, it's specific, it's not judgments, it's not personality characteristics. There is not a lot that parents can do about actual behavior. They cannot crawl inside their child and make them put on their shoes or make them pay attention or stay calm or whatever it is. There's not a lot they can do about that, but there is a lot that parents can do on the antecedent side, what happens before the behavior. And this can be right before the behavior, such as how they give an instruction. It could be the night before, say for morning routine, right? Getting to bed on time or packing your backpack the night before. So anything before the behavior. Parents have a lot of control over antecedents, and parents have a lot of control over consequences. What happens right after the behavior? These can be positive consequences, they can be negative consequences, it can be attention of some kind. So this is the model that we're using both to analyze behavioral situations, what is going on here? What is maintaining this problem, both on the antecedent and the consequence side? And then we also use this model to think about, well, what are some antecedents we can change? What are some consequences we can change? So I'll be talking a lot more about both antecedents and consequences. So as a quick snapshot, and I'll talk about some of these, a lot of antecedents, of course, there are, many more than what I've listed here, but what we really focus on in PMT is, the parent-child relationship, effective instructions, lots of routines and structure that we know is so helpful for kids with ADHD. This is why sometimes we hear, by the way, that kids do well at school, but not at home. Well, there's a lot of structure in schools. Things happen the same way every day at the same time, and the behavioral demands typically are quite clear. So anyway, so routines and structure can be really helpful for kids with ADHD. Really, clear expectations and parents staying calm and well regulated is also really an important antecedent. Hopefully then, behavior is we have improved compliance, follow through, kids being more, independent. And then for consequences, these generally break down into both positive and negative. And of course, just allowing natural consequences to kick in can also be on that side of the model. Now, I'll talk a lot about positive and negative consequences, but in general, we always start with positive. We really want to encourage kids to work toward rewards. We know that's more effective than urging them to avoid a punishment. And everyone just feels better when kids can be, working toward a reward instead of parents using punishing type of strategies. So we always start with positive. In our protocol is an 8-week protocol when we do our parent and child groups. In individual PMT, it may go, 8 to 12 sessions or even longer. So one antecedent that we always start with, and this is not just in PMT, but I know in PCIT, parent-child interaction therapy, it's the same. We really want to make sure we have some kind of positive parent-child relationship as a foundation. It is very hard to move forward if that is not in place. And in some families, this is already pretty good, but in some, especially if those negative parent-child interaction patterns have really taken hold, there can be a lot of negativity in these families. So really, we want parents to spend more positive time with their child, special time, right? Consider this kind of, I always say, money in the bank toward positive behavior change. If we're going to be asking, if we're working with a family and we're going to be asking in a few weeks for that child to change their behavior, well, the more that we've really engaged in lots of positives and we really good relationship, much more likely for that to be effective. And everyone's just going to feel better when they're more on the same page and there's more positive interaction. So, we recommend something called attending or special time, where really, the parent is just watching the child play, the parent's giving undivided attention, but not directing the play and not making evaluative statements. You think about it, kids with ADHD, kids in general, but especially kids with ADHD are constantly being told, do this, don't do that. No, 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 don't do that. So it's an opportunity too that they're just directing the play and the parent is just watching and enjoying it. So this can be a really nice thing to encourage parents to do. So again, in your consultation sessions, if it seems like there's a lot of negativity, to really encourage special time, doing things the child wants to do, even if the parent isn't that into it, to still do that in a way that the child's getting their undivided positive attention. Another antecedent, a real basic one, and again, this is an example of something that we can model in our, even in a brief consultation session to really model using effective instructions. I start with families talking about ineffective instructions, kind of to normalize it, because a lot of parents will look at the list and say, oh, do all of those. And I say, well, that's why they're on the list, because they're so common and so easy to do. So for kids who don't have ADHD, ineffective instructions can be fine. Kids will still follow through. But for a child who's inattentive or hyper-focused, which is also common, these can really be problematic. So ineffective instructions are things like lots of talking, just lots of rationale and explaining and going on and on about something that's very straightforward, that they want the child to do. So an example of this is that I like to give is, you've played long enough today. It's time to come in and do your homework. You haven't done any so far this week. Don't you know how important that is? If you don't do your homework, you won't get a good grade. Don't you care about your grades? And somewhere in there is an instruction, and it's time to come in and do your homework now. So we really try to work with parents on just keeping it simple and being real directive about their instructions. And then, of course, also not chaining a lot of instructions together. A lot of kids with ADHD can really just do one or two things at a time, stating them in the form of a statement instead of a question. So instead of, will you do your homework now? Or how about you get started? Just saying, time to get your homework started. You can still be polite about it, but not say it in the form of a question. And then repeating instructions over and over again with no end in sight, vague instructions. And the distant instructions, I would say, are kind of most commonly a problem, and that parents realize how problematic it is. Yelling things across the house, even though they're not yelling at their child, kids still experience this as yelling. And they typically yell an instruction, nothing happens. They yell it again, they're getting frustrated. Eventually, they have to go to the child's room, get their attention, and give the instruction. So I really encourage, when they can, just stop what you're doing, go to the room and give the instruction once you have their attention. And this can really shift things too. Kids will say, there's less yelling now. It's so nice. And parents all along have been saying, we're not yelling at them, but we yell to them. It still is experienced as yelling. So we really work with parents on that. So we really want them to, shift to give effective instructions, much more likely that the child will follow through. So again, this is an important, pretty basic antecedent that for some families can already, they can see some shifts. And essentially, we're setting the child up to succeed. That's what we think about when we're thinking about antecedents, is setting the child up to succeed as much as possible. So as I alluded to earlier, just creating lots of structure and routines is also very helpful, not just for kind of day-to-day, getting through routines and getting through the day, but also teaching kids this skill that when you have a lot of things to do, it can be a great thing to make a list and check things off as you go. It's an executive function skill that a lot of kids, especially with ADHD, just don't develop over time. So this is also a way of teaching them this really helpful skill that's going to come in handy once they have multiple teachers in middle school or in high school or in life, really. So ideally, we put together structures for morning routine, for homework, bedtime. It's most successful when the kids are involved in designing the program. So we really want to set up some kind of a visual task list. It can also build independent skills, because then we would suggest to the parent, don't tell them what to do moment by moment, put on your shoes, now brush your teeth, now do this, but refer them to the list. Hey, go check your list. What's next on your list? It starts to build more independent skills. So really we want this posted and to clarify how many prompts do they get, right? To try to do it with just 2 reminders and then eventually go to 1 or fewer. And, using things like timers and, songs to stay on track. Being reasonable about time limits, though, is especially during gaming. We don't want to cut kids off abruptly as they're playing a game, because it might be that if we just allow them another, minute or two, then it would be a good stopping point. So we want to be somewhat reasonable. And, a lot of parents will say, "Eh, it's just a few things in the morning. They know what to do." I still post the checklist anyway. It's really, really helpful to have that visual list, even if it's only a few things. Very, very important. I just put up some samples here that I've put together for families. This one that I'm showing right now was actually very helpful for the families. A lot of parents of kids with ADHD have ADHD. And they might have a bedtime of 8:30, and guess what? They're not even starting dinner until 8 o'clock or something. So this is an example of where it's not just helpful for the child, but also helpful for the parents. Like, oh, we've got to get dinner going, like around 7. And wow, he keeps asking for a sandwich at 8:30. So let's do kitchen closed at 8, or some things that are not just helping the child, but also really helping the parents kind of stay on track. Like, oh, we don't want to give that melatonin gummy right at bedtime, but let's give it right at dinner time. So this is an example of something that can be helpful in the evening. Let's shift now to talk about consequences. Of the most basic, again, antecedents are really setting kids up to succeed. Once they do succeed, hopefully then the parent is going to follow through with praise. We refer to, parents are, we're typically really good, not just parents, but are good at catching the things that aren't going well. We want to really catch them being good. Sometimes using this just basic praise and catch being good. I actually have a family we saw this morning or yesterday, who they said they started using this, and they said their child just they said, oh, he just melted. He was like, wow, you're finally he even said, you're finally praising me. You're finally recognizing when I'm trying hard, because they'd been so focused on all these things that he wasn't doing well. So this can really be powerful for lots of kids, especially when there's just only been these kind of corrective feedback for a long time. So the best type of praise is really specific and labeled. It's a way of saying, do this behavior more, instead of just nagging. So for example, I've written, instead of, if you give an instruction and the child does it, instead of just, oh, good job, like, oh, I really like the way you turned that tablet off right when I asked. Or, wow, you got right. I didn't even have to say anything and you put your shoes on. That's great. So really specific, labeled praise, and often, especially at the beginning of treatment, we want to overcorrect. So if parents aren't giving a whole lot of praise and they give tons of it, well, even once the treatment is over, even if it decreases a bit, it's still going to be more than at baseline. So ideally, the ideal ratio is for every one negative or corrective thing that a parent says, to try to say 4 things that are positive or praising. That's a tough ratio in a lot of families. So I say, even just for every one negative or corrective thing you say, find one thing to praise. So even if it's like, oh, you put your seatbelt on, or wow, look at you, that's really good handwriting, whatever it is. And then especially for areas that we know kids have a hard time, if a child has a hard time sitting still at dinner, and typically after about 10 minutes, they are up and running around. So at 5 minutes, let's praise them for sitting nicely, right? That can help. It's a way of prompting to continue sitting, right? So really using it strategically, really catching them being good. Again, this is something we can do in our consultation sessions, right? So when you're working with a family, using praise, I do this a lot, even in the waiting room, like, oh, really good job following directions. So first of all, it's a nice way to connect with the child, but also we're modeling it for the parents when we're using praise and catch being good with our families and with our patients. So we also want to, encourage parents to praise effort. A lot of times kids with ADHD, when they put a lot into things, they still don't do as well as their peers. So praising efforts, not just ability or intelligence. And the other thing to kind of watch for when you're working with families, some parents will praise, but they spoil it a bit with this negative tinge. Like, oh, good job cleaning your room. And was that really so hard? Or like, wow, you got your homework done. Like, why can't you always just do it? Like, so it just adds that negativity to it that can kind of really spoil the actual praise. So we really encourage parents, just keep it, wow, good job cleaning your room. I really appreciate that. It sounds so simple, but this can be hard for some families. So we want to really encourage that as well and really use lots and lots of praise. And then in addition to praise, again, we want to boost that motivation system that I mentioned earlier. So in addition, sometimes praise can work for some things, but really for a lot of kids, kind of backing that up using rewards is really necessary. So now you've probably heard parents, I've heard parents say, like, we don't believe in use of rewards, we don't do that. And I would argue that even parents that say they don't believe in rewards and they don't want to use rewards even though they don't realize it. So for example, any parent who's ever said, like, after you're done with your homework, then you can play on the computer, they're using a reward, right? There are kind of informal versions of this that we do all the time, like have your dinner and then you can have dessert. You are using a reward. So even with families that say they don't use rewards or they don't want to use rewards, say, well, let's just use let's work with what you're doing now, just make it a little bit more systematic and make sure that we're also not, we don't have negotiations going on about those rewards or when they happen. So anyway, so wanted to mention that because sometimes that does come up and it can be a little bit a tougher sell for some families to use rewards, but that's a nice way to approach it, I think. So there's some things to think about that are real important in use of rewards. Again, we want to be real strategic. We want the reward to be potent and meaningful to the child. What is the best way to know? It's to ask them. We actually have a reward survey we give to parents to go over with their child. So, and we don't just want parents ideally to be using, well, screen time, of course, is a real popular one, but not just stuff. This isn't just about going out and getting a bunch of stuff or buying them things, but time spent with parents, special activities. I once knew a parent that they were to reward, it was something related to showering or bath time. If the child, took their bath, the parent would put a towel in the dryer and then greet the child with a big hug and this nice warm towel. And that was the reward. So real creative, involved kind of touch. So anyway, it's not just stuff. It's time with parent. It can be things like getting to pick the movie on movie night. Other little things can be really rewarding for kids. So asking them, in other words. Rewards are going to be most effective when they're given right away, especially for younger kids or when you're just starting off the program. So for example, a morning routine reward given right away in the morning. Sometimes that is hard to figure out what that will be, but we spend a lot of time working with parents on that. And then of course, still using lots of praise. Eventually, we fade out the actual rewards, but we still want to be giving lots of praise. And really working with families too on not negotiating, not giving in to negotiations about rewards. Ideally, we want both daily and weekly rewards. Things that we can give daily don't tend to be quite as exciting as what we can do on the weekend, right? And I set parents up to know that they're going to have to change the rewards. You all may have heard, I know I've heard parents say, oh, we did a reward program, it didn't work. Eventually, they just weren't that into it. Well, I think anticipating that it's going to have to change over time is helpful for parents to know. This isn't something you just set up and let it roll for the school year. Yes, they might, again, screen time is the exception, I think, for a lot of families, but for a lot of things, maybe they're really into a certain reward for a few weeks and then we shift to something else. But that's why we go back to the reward menu, the reward survey. So it's not just one thing that eventually they get bored with and then we just drop the system. Nope, we'll come up with another reward. Let's ask the child what is going to be most rewarding and work with that. So really what the bulk of PMT is really working on developing behavior plans. We call it a home challenge. There are other phrases for it, but essentially we're connecting the antecedents and the consequences. There's a point system that you can do that works really well for routines. You get a point for each thing you do. And then, you tally it. give them a reward daily and weekly. That's a great system. It can be a little burdensome for some families, especially when they have multiple kids that are all on some kind of a point system, but this can be good to start with. There's the basic when-then system. Do this, and then you get this. You do your homework, then you get screen time. Get through your morning routine, then you can play, skateboard a little bit or something like that. This is kind of most natural in a lot of families and what most behavior plans, even a point system, kind of ends up evolving to. There's also, for specific behaviors or low base rate behaviors, this, like, I call it the marble jar program, or some kind of a token program where just for doing a task, they get something. You just earned a marble, or you just earned a ticket or something. And each one of those adds up to 10 cents or 5 minutes of screen time or something like that. And they can kind of watch that. And then the marble, kind of the jar, get more and more full, and then cash that in. So that could be helpful for specific behaviors. So we want to build into the program that the child's going to need prompts, right? We don't want to have an all or nothing system that they suddenly just have to do it to get their reward. We want to build into the system that at first they might need a couple reminders, but they still get it. And then we'll eventually move to, okay, you get 2 reminders, then 1, and now we want you to do it independently. And that's happening over time. Most behavior plans are going to be most effective when we start with a reasonable number of behaviors. I've had families come with spreadsheets, Excel spreadsheets to start, which we pare down to 5 or 6 behaviors. So a morning routine is best to start with because it's the most consistent routine of the day. We really want to set kids up to succeed. If they are not earning a reward early on in the system, the motivation is going to really tank. So we want to set them up to succeed, be super enthusiastic, lots of praise, lots of rewards, and not set up an all or nothing system. So for example, if you get through your morning routine 5 out of 5 days, you get a play date on the weekend. Well, what if they don't do well on Monday? Well, then there's no motivation for the rest of the week. So we want to be careful about an all or nothing program and be really consistent, be really matter of fact. If they don't earn their points one day, involve the child in setting up the system. Where do they want it posted? What do they want? What order should we do things? The more they're involved, the more buy-in they're going to have to the program. And I really encourage parents to be very positive about the program and frame it as something for the whole family. This is something we're going to do in the morning so that so I don't have to nag as much, and we can all get out of the house more quickly, and we won't be late, is much better than, well, you've been really slow in the morning, so now we've got to do this thing. And it's really, again, it has that negative tinge. We want to hopefully be as encouraging and positive as we can when we set up this program. So you can't see it very well, but here's an example of a point system program. You can see there are, 1 point for each behavior, and then there's a menu of rewards at the bottom. It's not an all or nothing system that if you earn 6 points, you get this, and any fewer than 6, you get nothing. But 4 points, you still get something. And then there's also a weekly reward, so that's the point system. The when-then system, get through these things, then you get to pick from a menu of rewards. As another example, here's an actual checklist that I put together for a family. So notice the important things to notice here. First of all, it's just a handful of things that he does every day, 2 reminders per step. The family has clarified 2 reminders. We want to make sure that on the day that he needs no reminders, and on the day that he needs 10 reminders for each step, that he doesn't still get the reward, right? We want to make sure we're very specific on what we're asking for. So he's going to get through all this. We're really specific too about taking this pill within a minute. And if he's done by this time with only 2 reminders, here's his reward. And notice it's immediate. It's on the way to school. He gets that iPad time. Got to eat half his breakfast, though. That's another important part of it. So you notice that the time is specific, the number of reminders, and the little checklist. This went into a plastic folder, and then he would use like a whiteboard pen to check off each day, and then they'd wipe it down and then go to the next day. So that's another one. So negative consequences are strategic or planned ignoring for attention-seeking behaviors, for things like whining, calling out, really pushing parents' buttons. So we essentially really encourage parents, you've got to not give attention to this behavior. Every time it happens now, you have to ignore it and really ignore it. But Here's what's important is to tell parents if they're going to use this to anticipate it will get worse before it gets better. That means it's working. And parents really have to be prepared for this because the behavior can get considerably worse. If I'm used to getting a lot of attention for whining and complaining, and then suddenly I don't, of course I'm going to get louder, but it can't go on forever. So we want to really, this is what we call the extinction burst. It's very important that parents stick with it and trust that it will work. Because if the child gets louder and louder and louder or more attention seeking, and that's when the parent says something like, I told you to stop, or whatever it is, guess what? They've just reinforced the escalation of that behavior. But if they really stick with it and really keep ignoring, eventually a child literally cannot whine forever. They cannot beg for whatever it is forever or tantrum. It will eventually, the curve will eventually flatten out. So each time, if they really ignore it, will get better, but it will get worse first. Same thing for things like changing up a system where, wow, we used to really allow a lot of negotiations, but now we're not going to negotiate. Or we used to be pretty easygoing about this, but now we're going to really stick with it. It will get worse before it gets better. And I think for parents to know that, anticipate that, prepare for how they're going to stay calm and really stick with it is important. So another negative consequence is just removing privileges, which parents do. You know, this is kind of a natural thing for parents to do. You've lost some screen time, you've lost a toy, you've lost a privilege. We really encourage, though, doing this systematically in the same way that kids know, if I get through my morning routine, this is my reward. It should be a very clear, if I don't do my chores, then I don't earn half an hour of screen time. That it's always half an hour. It's always the same. It's very systematic. This really can take the heat out of the interaction, right? When parents get really upset, oftentimes they'll take away privileges for the whole month or the whole week. The less time, actually, the better. So losing screen time for a day is much more effective than a whole week. We really want to set this up in advance and giving a warning, staying calm, and really adding this into the behavior plan after you have some traction with just keeping it positive and just focusing on rewards is best. So start with just rewards. That's going to have some traction for some things. If there's some negative behaviors that are still really outstanding, then we can use removing privileges perhaps, but we want to be very systematic about it and keep it short. Timeout, I'll mention just because a lot of families use this. I'm not going to go into each detail of this. Again, this is a slide that you can refer to if you'd like. But really, just knowing, my hope in showing you this is that, if a parent were to come in and say, oh, we're having a hard time with timeout because they keep leaving timeout, you'll have some ideas of what to do. Or if they say, oh, we're doing the timeout, it shouldn't be in the child's room. That's really rewarding. We want it to be in a boring area for a relatively short period of time. Parent stays calm, that this is a very matter-of-fact thing that they're going to time out, that it's very clear, just one or two behaviors like hitting a sister or really being disrespectful, something like that, that it's brief and again, just matter-of-fact, and they have to do it each time and that there isn't negotiation. I like to really contrast this with recommending a child, say they're getting kind of dysregulated and they could really use some time to calm down. That's a good time to say, hey, why don't you go to your room for a bit and draw or listen to music? But that's really different from timeout, which is a punishment. So really keeping that language separate of timeout is a punishment for a specific negative behavior. Here's the protocol for that. But hey, if you need to just calm down, take it easy, go to your room and chill for a bit. But the go to your room is not thought of as a punishment. I think it's nice to keep those really separate. And I know we're running a little short on time, or I'm running short on time, so I'm gonna speed up a little bit here. This is just an example of how to really troubleshoot using the ABC model. So in the top part there in red, we have the problematic behavior. The child is playing on their tablet instead of getting through their morning routine. So first we analyze, well, okay, what are some antecedents that are maintaining this happening? Well, they have access to their tablet whenever they want it. We haven't posted the behavior plan. We haven't really talked about rewards in a while. Oh, and yeah, they just are able to just grab the iPad anytime. What are the consequences in place? Well, right now we're using stickers. Does the kid like stickers? Maybe not. So, okay, maybe that's not a great idea. So first we use this model to analyze what is going on here, both on the antecedent side or the positive side, or the consequence side, and then think, what is the positive opposite? What is the positive opposite? So it is the child is independently getting through morning routine. So we always want to be framing these things as go behaviors instead of stop behaviors, first of all. So what do we want to tell the child to do? It's one thing to tell them what not to do. Well, what do they do instead? So in green on the bottom there, we want them to complete their morning routine independently. So what are we going to do on the antecedent side to be more supportive, to set them up to succeed? And then what are we going to do on the consequence side? So again, we're both analyzing the situation and thinking about what we can change on both ends of that system. So there are still challenges. As I mentioned, of course, a lot of our parents of kids with ADHD have ADHD. So we have impulsive, disorganized parents. Oftentimes, parenting really impulsive, disorganized kids. So that can be real tricky. And a lot of parents, it would be nice if they could drop their kids off and we could just treat their ADHD, but it doesn't work that way. It's really parents changing their behavior. We always are setting goals in our treatment, some child goals and some parent goals. And a lot of parents, the best way that we know how to parent is how we were parented as kids. And a lot of times these strategies are kind of in contrast to maybe some of the harsh negative parenting that parents kind of grew up with. So and especially when we have two parents that are really in high conflict, either still together or separated, that can also really present some challenges. And accessing this treatment can be a bit of a challenge. I will have a resource page at the very end here. So I'm hoping some of the key takeaways are that, during consultation visits, during sessions with parents, even if they're brief, to still be able to use kind of labeled praise, effective instructions, modeling that for parents. I'm encouraging parents to engage in self-care. That's a big antecedent for staying calm. A lot of the tools we talk about involve parents staying calm. And then again, you can encourage a lot of these, even in the absence of behavior plan, just encouraging special time, using effective instructions, using lots of praise, and catch being good. Really, really important. That alone can have some positive change. And also, again, really encouraging parents that when they start to, when they have patterns going that everyone is kind of fallen into, if they're going to try to create change, things could get likely will get worse before they get better, but hang in there, stick with it, be consistent, but definitely don't once in a while try it and sometimes not, because it often will really reinforce the behavior even more. So really encouraging them to plan how to stick with it. And then here are just some resources. If in the Bay Area, of course, we in our clinic, we offer PMT. Here's a website for the PMT national organization. So they have a find a PCIT, a PCIT therapist. You can find that at the PCIT.org. CHAD, Parent to Parent, they offer, and CHAD.org is an amazing resource for parents of kids with ADHD, but they offer a program in the Bay Area, San Francisco Parent Training Institute. Alan Kasdan has a store with lots of training resources, and then Barclay's book. All right.
Thank you so much for that excellent talk. We do have a few questions that have come in. One is, any tips for parents of older teens who are stuck in a pattern of negotiating, or general advice for motivating and rewarding teens who are becoming more independent from parents?
Yeah, that's tough. So here's where this can be, some of these patterns that I've talked about are even more ingrained, of course, but at least trying to enlist them, think about what motivates them. And typically what motivates teen is having parents off their back, having some screen time, having some time with friends. So still really working out some of these when-then systems. And for a lot of kids, that can be helpful to really stay consistent with that. Now, for families where when they try to implement that, the kid just leaves, or that the teen, wow, they just disappear. That's when getting into some family therapy is really, really helpful for the parents to be able to implement that consistently and in a way that's going to be most effective. But really coming up with some behavioral contracts with a kind of so-called neutral third party like a therapist can be most helpful. But those basic when-then systems are what are going to be most helpful for teens. They often still need that structure though, and some task lists and things. Executive function coaches can be very helpful for teenagers. Again, not so much for the oppositionality, but for just homework, getting through routines. Gosh, getting an executive function coach can be a great way to go for teens with ADHD.
And do you know how you would find executive functioning coaches?
Yes, so typically it would be educational therapists. So the Association of Educational Therapists, it's aetonline.org, I think, .org. They have a find an educational therapist list, and they have a search, that you put into the search. Study skills, I think, is it. Also, just asking at the school if they know of any, but typically these are educational therapists that really specialize in study skills, organizational skills that can be really, really helpful. And many now do work remotely. So that can be helpful that kids are able to chat with them, or, even not in a session, they're able to get some support, some phone consultation. But yes, executive function coaching, also ADHD coaching can be helpful. And typically chad.org probably also has a resource page, but AET online would be a good way to go.
Fantastic. There's also a question about any recommendations for obtaining PCIT. Like, where can they get it? How can they find who's in their area?
Yeah, so I would go to the pcit.org. I listed it on the, let me see if I can get back to it. Yeah, so I would try pcit.org. So know that now PCIT, it's tricky. You want someone who's been certified. And I think pcit.org will only list those who are actually trained and certified. And this is what's tricky, is if you look at some therapists' web pages, it looks like they might do a soft version of this. It might be better than nothing, but for classic PCIT, where there's actually, bug in the ear and there's that direct coaching using the skills, then I think pcit.org would be best for finding a therapist.
And so one of the questions kind of related to that had to do with, will insurance typically cover either PCIT or like parent management training, and any tips for finding somebody that's covered?
It depends on where. So, I mean, this is why our wait lists in the health clinic are so long. For getting this covered for a copay, instead of having to pay, hundreds of dollars, it's, we're kind of the only game in town as far as I know. So yeah, it is hard to get these services covered, but parent to parent through chad.org, that is, it's a nominal, it's a much lower cost. And I think they have like an online version. They have several versions of it. So the parent to parent through chad.org can be helpful. But yes, oftentimes, executive function coaches, these educational therapists, I've heard parents say like, whoa, it is not, cheap. So yeah, so trying something like parent to parent, or, Alan Kasdan's, again, that online score, I think it's literally like the ABCs, the ABC model, alive and well on Alan Kasdan's website. So using some of these online resources can be helpful. Barclay's book for younger kids. But yeah, I think chad.org for a parent so I would think universities would probably be the most likely to also have training centers. So for example, UCLA probably offers, at UCLA and their psychology department, they probably offer versions of this at a lower fee. So that is often a good option as well, is going to universities that have a clinical psychology program. They probably have trainees that are very well supervised that can also provide this. Psychology professional schools also will have interns that are probably learning these skills and be able to offer that at a sliding scale. Even if it's not covered by insurance, it'll be sliding scale. And that's often a good option, not just for what I'm describing, but just psychotherapy services in general. Training centers, universities, professional schools can be good options for sliding scale.
Absolutely. And I also wanted to point out Clarity Pediatrics in San Francisco that actually takes San Francisco Health Plan. It was always hard to find somebody who would take Medi-Cal, and this is a relatively new outfit. So Clarity Pediatrics, and maybe we can drop this in the chat in just a minute. Okay. Oh, the last thing I want to say is Triple P Positive Parenting has an $80 online course, which is often accessible for more parents than like hundreds of dollars an hour for a private psychologist.
Right. Okay. Good. Yeah.
Another question came through. I'm always concerned that by ignoring a behavior, we aren't acknowledging what a child is possibly trying to tell us. Although we may want a behavior to stop, do you ever suggest how they may present their complaint or concern in a different manner so we can respond to it?
Yes, so I want to clarify what we suggest using planned ignoring for, and it's typically the repeatedly asking for something over and over again. Can I have the iPad? Nope, you can't have the iPad. Can I have the iPad? I want the iPad. Can I have the iPad? I want the iPad. It's things like that, or using that kind of baby whining voice, calling out at bedtime. So yes, I think checking in with kids about is there something kind of going on that they actually could really use a hug or they could really use some, so kind of collaborating. But if it is a pattern that when I say, okay, I'm setting a limit and the child then spends just, parents will describe, they just wear me down and it does not end until I give in. Well, guess what? That's going to be maintained because that's rewarded, right? So behavior that is rewarded will be repeated. So yes, I think it's, of course, when I'm working with parents, I always say, you're the expert in your child. So I really always acknowledge that. PMT is a collaborative effort. I'm the expert on these tools. You're the expert on your child. So, for example, for kids who are really anxious, or it might be that additional strategies can be helpful, but in the end, it often is these like repeatedly or doing something that they know is going to really irk their parents, using a certain voice or a certain we all know what they are. It's really doing something to get attention for a negative behavior. Those are the behaviors we're talking about, to use planned ignoring, not other things, right? So it's very specific. And we often suggest, even if there are a host of things they might want to use it for, just start with one. Let's
Yeah.
just start with, we're not going to negotiate anymore about whatever it is. So negotiating is a big one in a lot of families. So yeah.
Fantastic. I want to point out that we have our QR code. This is the time to use your phone to scan that, or else use
Yeah,
the link
whatever.
that May dropped into the chat to check
Yeah.
in. Okay. So please take a moment to do that. Our last question that we have time for out loud here is asking about Amy McCready's Positive Parenting Solutions, if you're familiar with this, and if this is something that you might recommend. And or if there are other books that you might recommend besides the Barkley book that you've already
Yeah, Barkley
mentioned.
book, The Explosive Child is another one that's good. Gosh, there are so many out there, and of course, none are coming to mind. But yeah,
Mhm.
so anything that for ADHD, so yeah, so the kind of there's a big, positive parenting movement, and that's fantastic and can work well for lots of kids. I'm all for lots of positive. On the other hand, if for kids with ADHD, including something about routines and coaching for some of these skills, and we haven't even
Mhm.
mentioned the classroom version of this. Yeah, the
Mhm.
explosive child, exactly. That can be helpful. Barkley's books, any of Barkley's books that are focused on ADHD, Russell Barkley can be are really good. Your Defiant Child is another really good one, I think, by Barkley. And the 1, 2, 3 Magic books. So yes, so a lot of those can be helpful, positive parenting. But again, for kids with ADHD, especially, something too about routines, organization, encouraging task independence. I think that's also an important piece of the puzzle for a lot of them, because that's where they're really struggling a lot of the time. And so let's
Yes.
provide some support, some coaching. Let's coach parents on how to coach them is really one of my boxes.
Fantastic. We are at the top of the hour. Thank you so much for this excellent talk. Thank you to all of our attendees who are able to join us here for the noon hour. Hope you can come back in a month for our next webinar.